Goeiemiddag allemaal. Welcome to the best faculty. I think I should take Dr. Lombard home with me. Nobody in my family is so thrilled to have me like him. I've been assigned with the duty of informing you a little bit about student support, which is so important at a university. I'm Dr. Soma. I'm a full-time lecturer at the Department of Physiology. I've been doing that for the last 11 years and still enjoy every time I walk into the lecture hall. So for those of you who will be studying medicine and dentistry, chances are you'll probably be coming through one of my classes. You can't avoid me. I take you in your first year. I take you in your second year. I get you in your fourth year, even at the hospital. So most of the students are forced to be nice with me. I'm sure as most of you walked through, you saw some of our students, and you must have thought, but they look so happy and so relaxed. That's not mere coincidence. Okay? There's lots of organization, and obviously our student support plays an important role. So we are so afraid of saying this is the main campus, but between you and me, this is the main campus. So we call this the main, and on the Linwood, we say the Hatfield campus. At the Hatfield campus, they have a student affairs building, which comprises lots of specialists to assist students with immediate emotional support. There's a 24-hour crisis line. So for students of crime, hijacking, rape, sexual assault, or family acute problems, they are referred and there will be someone available to assist 24 hours. We also have an extensive academic support at the Hatfield campus. So students come from far and wide, and to bridge the academic gaps, we have people who teach language skills, how to study, advice on career paths as well. Because of the HIV epidemic that we live in, there is a special HIV and AIDS center for testing, which is run by qualified nurses and psychologists. So I'm not too sure about what happens exactly there, but I can tell you a lot what happens on the medical side. In charge of our student support is our deputy dean. It's run by Professor Manning. Her offices are just one floor above here. So most of the students are available to see her by appointment. And in summary, just a brief idea of the kind of support we render to our students. EMM, on the right-hand side, examination moderation meeting. All the marks after every semester gets discussed at the examination moderation meeting. Students who are getting less than 45% get called in by the School of Medicine chair. So Professor Juniortukkie will make you an appointment. We will ask you, why did you get 49% for this test only? Sometimes the students having family problems, parents are divorcing, there's insufficient money to pay the fees, and obviously it directly impacts on the student. Tutor, we have many tutors. Usually it's the senior medical or the senior dental student which tutors the fellow first and second years. After every lecture currently where I'm working in the second year block, we have third year medical students who have a tutor session after the particular topic. So today we discussed blood groups from 8 o'clock to 12 o'clock. There's a tutor session on between 1 o'clock and 2 o'clock. It's completely voluntary, but the tutors have lots of experience. They've been through the test. They know what's important. They know which lecturers can you believe when they give you good tips. I'm always eager to give tips if they bring me samosas, and the students know that. The mentor program, I will speak more about that. I am particularly involved with the mentor program. Then we have a special committee for students with impaired needs. So if there are students on wheelchairs, they will obviously need certain more things. And the impaired student committee will see to the needs of that student on the wheelchair. Conceptual tutor is also run by a Professor Lombard, not this Professor Lombard, but he is just as amazing as Professor Lombard. I think he's got his PhD in theology, hey, Professor Lombard. And he speaks 15 different languages. So to get you to adjust from matric life to university life and being far away from your parents, I guess is not easy. I still live very near my mom. So he sees to all the non-academic needs of students. If he thinks the student needs psychological or psychiatric assistance, he will arrange an appointment for that student. Medical students, despite having lectures from 8 to 5, are very much involved in assisting fellow students on this campus. And I think that is why our mentor program and student support is so successful. So the students in the residences mentor their own students. So the first year students will have a buddy in the second year, the third year, up to the sixth year. So this is all non-official things that they do. They also have their own mentor program, and they have Pulse. Pulse is a newspaper website generated by students for students. Lecturers are not allowed to touch the Pulse. Is that okay? So is computer literacy. We are moving in the era of computer-based testing. Our medical students' intake has increased to 350 per class. It's hard to give 350 exam papers and to mark that all the time if we have 4 tests per semester. To ensure students are able to use the computers, it is a compulsory course, the computer literacy course in their first year. Languages, we have a language expert who will make sure you are proficient should English not be your first language. So at the School of Medicine, English is the official language of teaching. The lecturer, though, is obliged to or can, if he or she is willing to answer in Afrikaans. All our exam papers and tests are in English and Afrikaans. Students have the right to choose which one they want to answer. In the upcoming years, I think Sepedi is going to be the next third language, so students will have a choice to answer in Sepedi as well. So, you know what that means? I'll have to go for Sepedi classes. How am I going to mark the questions? I don't trust anyone to mark my scripts. Okay. ARV emergencies. Students, unfortunately, we are all human. Needle stick injuries do take place. And what time will the needle stick injury usually take place? At 1 in the morning. Students are advised and they get taught, and they have little laminated cards about what to do in the event of a needle stick injury. Program is run by our Professor Anton Stolz. He's head of our infectious disease. Students are supposed to carry their own starter pack in their pockets. But typical students, it's not always there at 2 in the morning. So we do have chemists and pharmacists on call who will then give you the starter pack. But they will learn more about the ARV emergencies as they start their clinical work. As I've mentioned, we like our student to be a whole person, not only academically. We look at all different needs of students. Studying medicine is not always that easy. And as I always say, life is hard. Life is unfair sometimes. And you will deal with interpersonal problems sometime or the other. Stress and depression, eating disorders are common amongst our students. Life trauma, emotional problems, and life skills. So we have counselors, psychologists, psychiatrists, all on board to deal with each of these particular problems. As I've mentioned, students have their own student-to-student buddy system. It's usually developed spontaneously, and they have lots of fun. I know the Olympus campus where the guys usually stay. Who knows what happens there? Faculty house and residence level. So our students representing in the faculty house and the student house support also do their own tutoring and their own mentoring. It's controlled by them. There is not much lecturer input from there. So officially we have, as I've mentioned, the compulsory computer literacy course, the examination moderation meeting, psychiatrist and psychologist, impaired student, and time-out concept. Sometimes students battle, and what they usually offer them is a time-out. They take 3 months or 6 months just to get their life back in order, and then they come back to the faculty. That will be done by the chair of the School of Medicine. I am very much involved in the mentor program. It's run under the supervision of the Deputy Dean and Dr. Koch. Currently, this year, we have chosen 50 third-year medical students to mentor our first-year students. usually done in the ratio of 1:4 or 1:5. They are not there to give counseling or to do tutoring. It's just ideally for support. So the first year will say, I don't know where to apply for a bursary. That's where our mentor will come in. The student might say, I'm having a really tough time. I think I need to see a psychologist. They will get advised where to go and see the student. So this year we have 50 medical students and we have 17 dental students. Dental students are part of our mentor program, but they usually run it during the year on their own. We meet monthly. We have a general meeting, and we meet every alternate month with a subgroup. We are also kept informed about first-year problems. So there might be the chemistry test this semester was unfair. The marks are all bad, and most students got 40%. So at that time, the deputy dean might contact the head of chemistry to discuss what is the problem related to this test. Why did our cream of the crop students only get 40%? So we kept informed all the time. So these third-year medical students volunteer to take part in our program. There's no monetary remuneration for them. They have to use their own airtime to contact the first-year students. Some of them meet their first-year students and decide to go out for coffee. We advise not to meet for beer and other alcohol. Okay. But typical students usually do the opposite of what they advise to do. We also have, most of the students want to know, so why can't I have a mentee of the opposite gender? Can you imagine the problems we'll also have? So the guys are quite upset because they only get to mentor the males in the first year. And then, as I've mentioned, we have third-year medical students, for example, tutoring first and second-year students. So they will look purely at what's taking place, at the concept that was discussed. We also have then our contextual tutor. His name is also Professor Daniel Lombard. And Professor Daniel Lombard must be 60, 70 years old. I dare to think what's going to happen if he decides to stop working. Okay? Maybe that's where gene cloning becomes important. Okay? Any questions? That's all I have. Thank you very much.